Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome back Carlo Mahfouz. He's a technology executive and the author of the book, Reality Check, In Pursuit of the Right Questions. Today, we're going to talk about how AI can save lives by simplifying communication. Carlo, welcome back to the show.
Thank you so much. Excited to be here, Kevin.
So Carlo's been on before. Go to kevinmd.com/podcast to search his name and see his prior episode and story. Today, we'll jump right into the most recent KevinMD article, How AI Can Save Lives by Simplifying Communication. So, Carlo, for those who didn't get a chance to read this article, tell us what this one is about.
Absolutely. So in this one, I'm honing in right into the trendiest topic of today, which is artificial intelligence. And this time, I'm taking you on a different lens in how artificial intelligence can lend itself to be a useful technology, especially for healthcare professionals. And specifically, not talking about intelligence. I think there has been too much hype on what it could replace, the avenues on like knowledge, especially diagnosis, all of those things. I think those might happen. They are important, but I would like to talk about today is what it will present as an interface, as a way of facilitating the communication layer. And I think that's a very different lens than what has been discussed so far mainstream.
All right. So I'm interested in hearing that perspective from your lens as a technology executives. And you're right. We have a lot of physicians talking about how AI can replace some of the tasks that they're doing. So I'm interested in hearing your view of that intersection between AI and healthcare.
Awesome. So in this sense, specifically, we're talking about the interface. So typically in a lot of the tasks that happen in a hospital or in education and the healthcare, there is too many layers of communication that end up happening and too many stakeholders in that ecosystem as a whole, right? And one of the key advantages of what artificial intelligence, or specifically the new language learning models, which has been introduced, especially with the prevalence of OpenAI, has been this way of accessing data in a much more seamless way. And in this context where you no longer just ask a question and get a search result, or ask a question, or you have to have like multiple ways to get to where you need to. The artificial intelligence or the learning model for the most part is synthesizing most of that data and giving you an answer. Of course, there is refinements. It's not necessarily 100% accurate, but there is value in that, because what now we can do is there is a lot of these tasks which are mostly translation tasks, where it's just relaying data from one stakeholder to the other stakeholder, right? And that could be completely removed. That could be completely kind of abstracted out and removing it as a friction point. So one which maintain the integrity of the data or the communication layer in between, but at the same time eliminating it from the process, which will simplify and reduce the bottlenecks which could be available in that ecosystem. Because the more touch points we have, the more the data or the communication flow moves from A to B to B to C, you kind of introduce more points of failure.
So give us an example, a real life example or scenario where you see AI facilitating that interface between patients and the healthcare system.
Sure. The simplest one recently to, checkup visit. And one of the first thing the MD brought up, he brought up a laptop with him. And before he actually engaged in the conversation, he turned on to just transcribe and get the summary of that interaction. At the very basic level, minimally, that's really one of the first steps. Is that relaying of that information probably required someone to document it next to you, or like take notes, and then to provide that to you. And all has now been packaged and like hit record, get the transcription and the summary, and you're able to digest that after the fact, right? Another good example of that could be, when we're looking at diagnosing someone and we're looking at coming into a new patient, I think the amount of knowledge that it is necessary for you to come prepared is a lot. And it could benefit from signaling to which areas there might be deficiencies, or like there might be areas that are overlooked. And I'm not saying here that the artificial intelligence will collect all of the data and telling you this is what you do, but instead what can it aggregate based on the history of the patient, the history of your knowledge and education, and say, there is these things that might be interesting for you. It's a nudge, and present it in a very easy way to just, so you need probably 2-3 minutes and you can go over that. And then you're a little bit much better prepared for that type of engagement. So these are small changes, nothing, instrumentally huge, but I would say can improve the overall experience.
So there's been so many technological advances when it comes to healthcare, and a lot of them come and go. Very few of them actually change the way we practice and change the way patients interact with the healthcare system. But I'm feeling that AI is a little bit different. So I'm interested in hearing your perspective as a technology executive. So tell me, is AI different from prior technological advances? And if so, how is it different?
Great question. And I'm going to jump back to the interface because I think it's a really meaningful one. So in my industry, we work in simulation, and I can tell you one of the biggest technology advances when, the resuscitation, like a mannequin for resuscitation was introduced, technology innovation had no friction for people to use it because what they ended up using is something familiar with, whether, to present a CPR. And I think that's a challenge. So when a lot of the technology today, especially if we talk about electronic medical, electronic health records or any of that sort, when your interface is a touch screen and a keyboard and a sets of menus and like multiple layers to get to where you are, you're introducing a whole new way of working, which is already taking your attention from what you need to do, which is basically save someone's life, right?
Hmm.
An engine is different. It is using what we already very well, which is language. Like, right, these language models are so powerful that they can talk, even if they hallucinate sometimes. And I think we can iron that out at some point. But they communicate in a much more seamless manner.
Hmm.
Right. And as a consequence, the interaction with the technology becomes more seamless. It becomes easier to, instead of capturing it by manually entry or by different manner, you just have to speak it. You just have that's the beauty of this transcription. The exchange, for example, didn't have to change. So it sits like on the side, not disrupting the current workflow of the physician and the patient in it, and supporting. And that's the value. It's not an added layer in the chain, right? And I think that's a really major difference in the technology because what we've introduced before over and over again has been another layer. You need to
Hmm.
do this on top of everything else you had to do, right? And now we don't have to do that. Like, right, it could just be, recording a video and interpreting on the video and telling you and checking things and making sure that this the right dose of medication has been administered, or basically just a transcription. So the next physician coming in can easily read and assess, oh, okay, I got recently the electronic health records, and I had comments on what is happening for an incident.
Hmm.
And I can guarantee you, like, if that was captured and I get it synthesized, because I do it for my business meetings all the time, I get a much better understanding of what's happening. And it's not getting it all right. Like, just to be clear, I'm not saying it's magic, but it's still a much better improvement. And that's a different now. That's a difference. It's no longer a new thing we're adding.
Hmm.
It's something sitting on the side, supporting, which is as seamless as possible. And that there is great value in that.
Do you feel like we're moving too fast? I think that things like ChatGPT, it's about a year and a half old, maybe, and it's come
Yeah.
such a long way now from when it first came out. Do you feel like we're getting too exuberant about the applications of AI, especially as it relates to healthcare? Are we getting too far ahead of ourselves?
I feel honestly we're going too slow. And I'll say that because ChatGPT was introduced in its hype. A lot of the technology has been around at least for 8 years or more. Like right now, it just created a new accessible format that more people were able to approach. And of course, more data that has been ingested, that the outcome of it was much cleaner in a way which is much more accessible. I think actually for healthcare to adopt, it needs to leap even further for the adoption actually to take place. Because, the level of error that is necessary is high. You cannot have a high dosage of error. So now one of the examples I put in the article as well is RAG, is like retrieval augmented generation, which basically what it does when even the ChatGPT, for example, is answering you, it's answering you grounded in a knowledge base.
Hmm.
And that's very critical, for example, right? Because I don't want it to basically create information out of thin air. So if anything, I think it needs to even move faster for the adoption to really start materializing in a good way. But again, I think though the changes that we can do today are small and very incremental, and they're not necessarily revolutionary. How can we optimize some of these small pieces in the chain that doesn't require, and where the risk is minimal? That's the key part, is that where the risk is minimal, the risk is not too high, where it, because the higher the risk, the lesser the adoption, and there's a relationship between that.
Do you see any downsides or risks about how far AI is going to be assimilated within our healthcare system? Any downsides?
I think there's a lot of downsides. I'm very optimistic about it, but I'm not saying that there will not be. In any technology transition, what ends up happening, we're in between the transition, and either you have malicious actors taking advantage of that transition and the lack of understanding as a consequence, because the technology is not brand new. And I hope keeping the technology open for more to access it will alleviate some of these things, because we will see innovation in securing it much quicker.
Mhm.
I think that's a model which will support it. I think there is as well the risk that it's going to make an error and we're going to basically shut down because it made an error. And it's going to make an error. I can guarantee you that. I don't believe, we see that in, automated cars. We've seen that now for a while in automated cars. And if you want, we can take a parallel on what that one accident in a car, which is self-driven, automatically says, oh, okay, let's shut down everything and this is not useful. But in reality, if you look at it, the accidents out of people actually driving and the craziness of that percentage-wise is much higher. But there is a cultural shift. There is a cultural shift in understanding and accepting that, and that's going to take a while. Of course, there is as well identity kind of issues and the AI taking like some personalization. And of course, there's going to be always the gap of knowledge where someone knows more on how to leverage that tool and kind of be able to abuse it. But the reality is that's always a risk. And it's a matter of us being more ready and prepared for it rather than just saying it's not going to happen.
So I think that illustrates some of the different mindsets, right, in technology field. Sometimes in technology, you're able to release things in version 1.0 and use some of those mistakes and errors in future versions to help perfect that tool. Whereas in healthcare, if you make an error, people get harmed or people can die,
Yeah.
right? So I think that is just an interesting juxtaposition between those two mindsets about how fast technology or technologists want to go, but how sometimes healthcare by its very nature can prevent that. What do you think about that?
So again, the risk is high because we're talking about lives here,
Yeah,
right?
yeah.
So that automatically changes the dynamic completely. And that's why initially I'm saying don't leverage it for things which are on like high critical, but you
Yeah.
still need to learn and understand the technology's capabilities. And that can be done. So in areas where the risk is less, or there is not as high risk, whether it's on the education side, where the training, the simulation, right? But you need to get to know the technology before you can actually use it and make sure that it actually doesn't harm people.
Mm-hmm.
But for that to happen, does not need to happen in the risk space, right? So where are the areas which are less risky? Where are the areas where errors could happen and they could be contained, right? Because we still need to learn the technology. Like we still need to learn what it's capable for. I would say I would put the difference in this, like someone who's completely not exposed to artificial intelligence and what it can benefit, and someone who is. The
Mm-hmm.
only difference is you need to be exposed, but in the areas where it's less risky.
Sure.
Like, right? Even if it's in things that you do just to improve your own efficiency on administrative stuff, which has nothing to do with the continuum of care or the quality of care, nothing along those lines, right? Start there. And that's okay, because then as soon as you start using it there, then you can start to see, oh, okay, some of this value. And because now you understand, and physicians like who is in that ecosphere understand it, can start helping the technologists on how best to adopt it. We need that communication layer because, it's not an either or, and it's not simple, of course, but that there is ways to kind of optimize for getting started and be able to understand where and how and when, more than anything else, that could move the needle forward. But in my vision, is it definitely will move the needle forward. And I do hope that we start now rather than wait. Oh, okay, let's wait till it's ready.
Mm-hmm.
It's never going to be ready. Like, right, realistically, there is not a point where we're going to say it's ready. It's more how we familiarize with the mindset changes. And that doesn't need to happen just in the context of healthcare.
We're talking to Carlo Mahfouz. He's a technology executive. He's the author of the book Reality Check: In Pursuit of the Right Questions. Today, we're talking about how AI can save lives by simplifying communication. Carlo will end with some of your take-home messages to the KevinMD audience.
Probably the take-home message for me is in healthcare, we look to standardize so much. We look to basically create a lot of homogenization to reduce and create a risk-averse like environment, right? I do believe artificial intelligence and streamlining these connections will allow us not necessarily to just leverage standardization, but integration. And there is power in integration, where we leave room for the innovation that's necessary to help save lives, but at the same time streamline the connectivity, the connectedness and communication layers between either one stakeholder to other or one system to another. And I think there is so much power in what we can accomplish in that.
Carlo, thanks again for sharing your perspective and insight, and thanks again for coming back on the show.
Thank you so much, Kevin.